Move on, as I say, something different. This has to do with health care. So the question is, do you support the current health care reform legislation as it stands? What changes would you have liked to have seen, if any, included? And I'm sure everybody has some.
Another easy one.
Prior to the enactment of this bill, 50 cents of every dollar that was spent on health care was spent by our federal government. Our federal government has already forced our medical professionals into involuntary servitude to serve those that come in without any ability to pay. And we're getting more and more of the government intervention. So what has happened since it's been put in place? Well, Principal Insurance Company has stopped participating in the health insurance market. They're withdrawing from it. There used to be child-only health insurance plans that you could get if you were covered by your employer, for example, but your child wasn't. The insurance companies have stopped issuing those policies as well. We've seen that colleges have had to withdraw their student plans as well because the health care bill would force them to offer it to those students after graduation in perpetuity. And we see more. I mean, recently a whole bunch of waivers were issued. Those waivers had to be issued in order to prevent more companies from dropping health care coverage. And every major company in the country is already debating whether they should drop their health care coverage for their employees in order to pay the fine. The fine being much cheaper. AT&T is an example, $4.7 billion. To cover current and retired employees, their fine would be $600 million. This is intended to set up a system in which the cards are stacked against the free market from day one, and we're seeing that already occurring. We don't need this type of problem. We don't need our problem fixed with this type of solution. We need a free market-based solution. All of us should be getting our insurance coverage, health insurance coverage, directly as individuals, not through our employers. If we did that, there would not be any portability issues. Without portability issues, there would be no pre-existing conditions unless you create those of your own choice.
I don't support the health care legislation and call for its repeal. The bill was passed against the will of the American people by politicians that did not know its contents. The consequences of the bill are already being felt in higher insurance premiums and loss of insurance coverage. Just this week, several companies received waivers from the bill's requirements so that they can continue health care for low-income people, which otherwise would have been lost. This is just one example of the problem to come. The bill creates higher costs for governments and insurance companies, raises taxes on individual people and on the companies that create jobs. This bill is an unconstitutional exercise of federal power. The bill's effect over the next few years will be to damage the U.S. healthcare industry so that the federal government will have the excuse to nationalize the entire industry. As it has in other countries, nationalized healthcare will lead to lower quality of care, rationing of care, and expanding government deficits. The government already controls Medicare and Medicaid. Both programs are financial failures. Doctors and clinics are dropping out of these programs because they do not cover their costs. People wait in line for care under Medicaid. Based on this record, the government does not deserve any expanded role in health care. We need health care reform that allows efficient relationships between patients and providers. We need health care reform that stops lawsuits. We need real health care reform, not a takeover by government bureaucrats.
Well, I want to start also by just sort of linking it to immigration. I was encouraged by what Stephen and Curtis said about immigration. I think it was up to three of us. We could probably come up with a solution that we could all agree on to solve this. Unfortunately, at the national level, politics is standing in the way of this. And the criticism of both parties. Your party too, but it's all open and bad. But seriously, I mean, there are too many people on the Republican and Democratic side who try to use immigration to gin up their base, respectively, rather than solve it. So there's unfortunately, a disincentive to actually solve it. I think we could do that. I hope that Congress does that. It ties into healthcare. In fact, when I gave my floor speech on healthcare, even the healthcare bill, there are 15 million people working here illegally, almost none of whom have healthcare insurance. And by the way, this bill doesn't cover them. That was one of the, so there's still 15 million people. That is uncompensated care. They're still going to the emergency room, still needing health care. Those bills are passed along to everybody else who can pay, higher insurance premiums for people who have insurance, higher self-pay for people who don't. because we have a large undocumented population, and that's one of the reasons, one of the many reasons we need to fix our broken immigration system. With regard to healthcare, let me tell you about what this bill that we passed means for Coloradans. Starting this month, September, last month, insurance companies can no longer drop your coverage just because you get sick. Insurance companies can't restrict emergency room care or charge you extra for going to an emergency room outside your preferred network, which makes sense because who plans for going to an emergency room? Could be in a car accident or anything anywhere you are. Patients are allowed to keep their children on their health care plans longer up to age 26. And and there'll be no discrimination on pre-existing conditions as well, as Matt Jones, who has a pre-existing condition, talked about. It could happen to anybody. It's not your fault. You're a survivor of diabetes, of cancer. You should be able to get insurance to be in one large risk pool. There's also an incentive, finally, for people to get off of government health care, to get off of Medicaid. One of the big problems with Medicaid is people are locked, it locks people into poverty. Because if they earn $1 more, I've talked to many people in our district, they earn $9 an hour, they say, I can't take a raise to $9.50 an hour. I lose my Medicaid benefits. I lose $3,000 in benefits to earn an extra $800 a year. There's a disincentive to work. Sometimes they work under the table. Sometimes they're just locked into poverty. We replace that with a sliding scale. So there's actually an incentive and a reason for somebody making $9 an hour to make $10 an hour, $12 an hour, $14 an hour. Their government aid decreases rather than cuts off at one level, so eventually they'd actually wean themselves off of reliance on government health care. So I think it's a very powerful incentive that will help lift people out of poverty across the country.
Okay, well, thank you again.